Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects, as well as rare but life-threatening complications of therapy. Today we're going to discuss Kadcyla therapy. Kadcyla is also known as TDM1 or Trastuzumab emtansine. First, to best understand how chemotherapy works and why we're recommending this therapy, We're going to need a brief refresher on biology. Don't worry, we're going to keep it basic. Remember, all living things are made of cells, and the blueprint for how a cell in our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a brief video showing this concept. So cancerous tumors are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. The cell cycle goes through the resting phase, through active and growing phases, and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells since the cancer cells divide faster. They therefore do not have a chance to repair themselves prior to cell division. We're going to show the cell cycle in the next video. So therefore, the scheduling of chemotherapy is set based on the type of cancer, the rate at which the cancer cells divide, and the time during the cell cycle at which a given drug is likely to be effective. That is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During this time, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not completed, side effects occur. Normal cells, most commonly affected by chemotherapy, include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects which can include low blood counts, mouth sores, nausea, and hair loss. Herceptin or Trastuzumab is a monoclonal antibody, and this is an antibody that targets a protein on the cancer cell surface called HER2 or HER2/neu. In about 20 or 25% of the breast cancer patients, this protein is overexpressed on the cancer cell, and it leads to uncontrolled proliferation of the cancer. Herceptin binds to the HER2/neu protein, which prevents it from sending its growth signal to the cell nucleus. The cancer cell is highly dependent on the growth signal and dies when it's blocked by Herceptin. Your own immune cells may also help kill the cancer cell after recognizing Herceptin on the cell surface of the cancer cell. The next video shows this schematically. So Kadcyla works by using the Herceptin antibody to deliver the chemotherapy drug to the HER2/neu overexpressed cancer cells. The antibody is linked to the chemotherapy drug DM1. Once the complex enters the cell, the DM1 is released and binds to spindle fibers and inhibits cell division, killing the cancer cell. We're going to now watch a video that demonstrates this process in more detail. The TDM1 chemical consists of a monoclonal antibody, which as we've seen is Herceptin. Remember, Herceptin is the monoclonal antibody that targets the HER2/neu protein, which is overexpressed on the cancer cell. This allows the TDM1 to only interact with cancer cells. The TDM1 molecule is Herceptin, which is combined via a linker to the chemotherapy DM1, which is the cytotoxic. DM1 is the chemotherapy that is specifically delivered to the cell by the antibody Herceptin. The entire molecule, TDM1, binds to the cell surface, and simply this binding to the cell surface is able to help kill cancer cells through a variety of mechanisms, which includes inhibition of cell signaling, apoptosis or induction of cell suicide, and something called antibody-dependent cellular cytotoxicity. Once the TDM molecule binds to the cancer cell, it is endocytosed or taken up by the cancer cell, as you can see, into a structure called the lysosome. Within the lysosome, the DM1 chemotherapy is released into the cancer cell specifically, where it can cause cell death by inhibiting the spindle fibers, which help DNA replicate. By inhibiting DNA replication, the cancer cell is killed, as you can see. Kadcyla, TDM1 or Trastuzumab emtansine, is given by vein, intravenously or IV, on the first day of the cycle. Each cycle is 21 days in duration. Anti-nausea medications may be given, but nausea is usually quite mild. The Kadcyla regimen takes about 90 minutes for the first infusion, but may be shortened to 30 minutes with subsequent treatments. Here the schedule is shown schematically, with Kadcyla given on day 0 of therapy, and 21 days passing before the treatment is repeated. The treatment is generally repeated until progressive disease is noted or side effects are incurred. Kadcyla is notable for rare infusion reactions. These reactions can be notable for flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are mild, but very rarely they can be serious or life-threatening. For this reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced by dexamethasone and other drugs such as antihistamines, which may be added as needed. Now let's review some of the side effects associated with Kadcyla. Most importantly, remember that each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has Kadcyla therapy. Rare cases of liver toxicity and liver failure have been reported with this medication. Therefore, your liver enzymes, which is a blood test, will be checked prior to each treatment. Mild increases in these laboratories, however, are quite common. Kadcyla can rarely cause decreases in heart function or the pumping function of the heart. Your heart function, therefore, will be measured prior to starting therapy and about every 3 months during treatment. Mouth sores, as well as nasal tenderness, can occur and can be minimized with mouth rinses and non-alcoholic mouthwashes. Blood counts, especially the white cells that help you fight infection, are reduced with this regimen. This occurs 5 to 7 days after treatment's given. You should report any fever greater than 100.5 or shaking chill to your healthcare team. You may be given shots to help promote recovery of your immune system. Numbness of the hands and feet can occur, and this is due to the effect of Kadcyla on nerves and is known as peripheral neuropathy. You may also notice that you have difficulty buttoning shirts or putting in earrings. It's important to report these symptoms to your doctors. They may be controlled by slightly lowering the dose of the drug. This side effect usually improves slowly a few months after the treatment is finished. About 1% of all patients treated develop lung inflammation. This is usually associated with severe shortness of breath. It can usually be documented by a chest X-ray if suspected. Kadcyla can affect blood counts, especially the platelets that help your blood clot. About 14% of patients treated with this drug will require a modified dose or schedule to allow the platelets to recover. Nausea is usually mild with this regimen and occurs somewhere between 6 and 48 hours after treatment. You may be given anti-nausea medications before your treatment by vein and by mouth as needed thereafter. Kadcyla can also affect fertility. Talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. Now let's review some frequently asked questions with regard to Kadcyla chemotherapy. Can I drive to my chemotherapy treatments? We'd like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver for subsequent treatments. Will I gain weight with steroids such as dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Not all patients will receive this medication, but if you do, be aware of your food intake as well as the quality of the food you're eating. Can I get manicures, pedicures, or massage therapy? Manicures and pedicures are usually discouraged during this chemotherapy. Avoid also harsh skin scrubs if you have skin sensitivity on the palms or soles. Massage therapy, on the other hand, is usually very helpful during treatment, but avoid deep muscle massage if your platelet counts are low. Are there any food restrictions? Well, avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find, however, that you prefer cooler, lighter foods and meals during treatment. Smoothies, for example, with protein supplements can be a healthy, attractive food choice during this time. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, however, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly with any dietary changes, and focusing on healthy, non-processed foods is always a good start. Should I take anti-nausea medications at home after my treatment? This may be necessary or recommended as a preventative measure, and we'll review this with you during your office visit. Once again, significant nausea is not a usual problem with this treatment. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please assemble a list of all your vitamins and supplements you're taking. In general, we strongly prefer that these be stopped until after your chemotherapy is complete to avoid any potential side effects. These can usually be resumed after therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter in the arm, ports are required for continuous infusion of drugs or for patients with poor or limited venous access or when the drugs are irritating the veins. We'll provide a brief video at the end of this summary to give you an overview of ports for chemotherapy administration. So in summary, Kadcyla is effective medicine because there's a therapeutic window. In other words, the drugs are specifically designed to be toxic to cancer cells while your normal cells have the ability to recover from the treatment. This therapy is usually well tolerated since it's delivered specifically to the cancer cell by the antibody Herceptin. The side effects of chemotherapy are generally mild, self-limited, managed with medications or behavioral changes. Severe side effects are very rare. Most importantly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That's really why we're here. Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than ½ an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.